Okay. Well, as you can see, we're recording, so we're going to get started because this recording will be shared with everybody who is joining us today and also who registered and is not joining us today. So thanks so much for coming. My name is Kate Mudge. I am the co-director of Care Farming Network. We also have Sarah Sorcy and Andrea Barnhart on from Care Farming Network, who are going to be helping out with today's webinar. For those of you that might not know much about CFN, we exist to support and grow the care farming movement across the U.S. And we do that work through connecting farmers and practitioners and advocates and partners who believe that farm-based experiences support human health and well-being. And we are very glad to have you here today. We have a webinar that we had originally presented at our conference just a few months ago. Got great feedback, so here we are with an encore presentation specifically to talk about partnerships, one of the most vital and sometimes most challenging aspects of either starting or sustaining a care farm. As we know, care farming sits at the intersection of agriculture and health, social services, and oftentimes community development too. And that breadth is one of the greatest strengths. And so we thought by spending an hour with partners who are helping to support or operate care farms in their region, we could learn a thing or two about that sustaining relationships of partnerships. So today, joining us are three fabulous presenters. We have Cher Harpster, who's an extension educator with Penn State Extension, and Cher's going to share her experience working alongside Sowing Hope Farm in Pennsylvania. Next, we have Jenna Umbriac, who is the Director of Programs at Manna Food Center, and she will be talking about how Manna partners with a care farm in her region to advance food access. And finally, Amy Grace, who's a licensed marriage and family therapist, and also the heart behind Imagine That Farm in Idaho, who will talk about her partnership with Children's Home and how that has helped expand care farming in Idaho. But with each presenter, they're going to take about 10 minutes, and then we will have some time for some questions before the next presenter, and hopefully a little bit of extra time at the end for Q&A too. So if you have any questions, please feel free to either hold them for the discussion time or feel free to throw them in the chat. So let's see, I'm going to do a little screen share here. And first up, we have Cher talking again about Sowing Hope Farm in Pennsylvania. Give me 1 second here to share my screen. All right. Welcome, Cher.
Thank you. It's my pleasure to join you all today, and I'm very happy to talk about my experience as an extension educator with a local care farm that was just starting out in my region in central Pennsylvania. So to begin with, as an educator, my area of expertise is in leadership and community vitality. So I don't do the typical extension education roles of knowing about agriculture or agronomy or forestry or poultry or any of the things that we typically hear about with extension. So when an odd question comes in, these questions usually get directed to me. So in the spring of 2024, a parent had contacted their local extension office to indicate that they were interested in starting a farm where her two grown sons in particular who had special needs would be able to work and be productive because they just loved farming. So at that point in time, neither of us were familiar with care farming or had any idea that such a phrase even existed. So we started on a journey together where we started talking about what she was looking to do and then reaching out to other organizations that were connected to Extension and connections that she had And we came upon the Care Farming Network. We found a couple of care farms that were close to us. We started visiting some care farms, and then the idea started taking shape for her. We met with Andrea and some of the team at the Care Farming Network and got some resources. And then we really walked through, and my job at that point was just to keep her on track, but only focusing on one step at a time instead of trying to do everything all at once. So we tried to find property. We went down the road of does she start her own farm? Does she rent a space? So we looked at lots of different opportunities, and I tried to connect her with individuals who could provide guidance and expertise in areas that were not in my area. So I provided information to her about business planning and writing grants, starting a nonprofit, those kinds of things. And then she ended up partnering with an individual who did start the nonprofit farm, Sowing Hope Farm, in her community, very close to where she worked. And then in the summer of 2025, they started with this one little greenhouse and these four participants that you see in the photo. Started doing some raised bed gardening and offering opportunities for young adults with disabilities in the area to come there for programming. So it started out as a very small venture. And if you go to the next slide, they are continuing to increase what they are offering. The individual in the center of the picture is the parent who had contacted us. She has a business, she does full time, and so this was her really on the side kind of venture. And two of the individuals in the photo are her children, and then there are several other local adults with disabilities there working with her. So that was a quote from her as the business owner. She didn't know where she was going. She just stopped at the extension office because extension is known to have a lot of access to resources and possible connections. And so I've been able to keep in touch with her over this time to help her reach people that still can provide assistance. So you can go to the next slide. Um, Extension exists across the country. Every state has some version of extension associated with their land grant university. Sometimes more than one land grant university is involved. The typical areas that we have expertise in include agriculture, youth development, health and nutrition, community development, even some workforce development. So, connecting with extension can lead you in different directions, but possibly connect you with somebody that is an expert in an area where you might need assistance. So I've continued to work with Sowing Hope Farm. As they grow, they are planting things outside. So I will connect them with somebody from our horticulture team. They have a little paddock and some fenced in areas, and they want to add animals. So I'll connect them with somebody from our animal systems team so that when they are expanding and offering different programs, they're doing things the right way. So, really, I know that was only 5 minutes, but it is kind of a short story. Extension can take you in lots of different directions. The areas of expertise are vast and are different depending on the state that you are in. But there are multiple ways that you can work with your local extension office. You can offer tours and bring out the extension staff to visit you and learn more about what you do. Check out what offerings they have, webinars, articles, professionals that serve in different areas, youth development, where they're able to get young people out to visit you and learn more about what you're doing. Subject matter experts, of course. And then just the ability to connect through maybe their local council. Almost every extension office has a local advisory council that wants to provide resources for the people that are in their areas. So there is a way to find out. Extension Foundation maintains a list for every state and tells you how to get in touch with your local extension office. Um, I think in the conference we talked a little bit about a new resource available through Penn State Extension, which is an AI tool that mines extension resources and gives you answers to questions based on extension research and information. So if you put in a question in our AI tool, which is called Tilva, you'll get an answer based on first Penn State Extension resources, But if none exists or few exist, it will go to other extension resources in other states and provide you with answers to questions. So if you have a very particular question, I encourage you to check it out and put it in there and see what kind of answers you get. And that's just one way to use the services without connecting with an individual. You can go to the next slide. If anybody has questions about extension in general, you want to know how to find the extension in your area or learn more about the different programs, that is our website, extension.psu.edu, and that can lead you off into other directions based on what kind of searches you do, or if you just want more information, feel free to reach out to me directly.
Thanks, Cher.
Sure.
I have a quick question for you. You kind of covered this already, but my question is if somebody is just sort of starting to explore care farming, you mentioned that you could reach out to Extension and do a tour, but it sounds like your extension differs across states, but you could get all sorts of help through business development or, um, well, all of tons of different areas of
Yeah.
expertise for extension. Do you have a suggestion for like what people need to know to bring to you to get their questions answered? Should it be a proposal? Should it be an in-face meeting? Just kind of the first step that somebody just thinking out or is just starting out in care farming might kind of have provided for their extension agent.
So it kind of depends on what the question is that you would have. I mean, if
Okay.
you're looking for assistance with grant writing or something like that, different extension offices offer different types of services. But
Hmm.
a phone call or a search on their website to see who the subject matter expert is that you would want to talk to would be appropriate because it used to be extension agents served a county, and the agent assigned to each county would kind of know a little bit about everything. But
Hmm.
in most states now, it's more subject matter based. So there might
Hmm.
only be four people in our entire state's extension service that know about growing flowers in a greenhouse, for example. But
Oh,
they can work with anybody anywhere in the state because that's their area of expertise. So it's more based on your subject matter and less your location. But start at your local office and just go in there with whatever questions you may have, or just to find out who is in your local office that you can connect with. And they will have resources that can provide help too.
well, I know at CFN, we often tout just the amazing benefit of working with Extension for care farmers. I feel like y'all do such good work, and sometimes it's really under the radar. So you're a wealth of information. I myself live in Minnesota, and I know that Extension provides some funding opportunities for projects too. So thank you for taking the time to go and help a aspiring farmer get started in care farming.
Yeah. Thank you for being there as a resource that we've found along the way.
Well, it was fun just for others on the call. Cher invited CFN to actually present about what care farming is to all of the Pennsylvania extension agents. And so, as a goal of ours, we really want to make sure that we are doing our best to build awareness around care farming. So, this concept is not brand new to extension agents and educators out there. So, thanks for
Right.
hosting us too. Let's see. Any questions in the chat? All right. I think we're going to go ahead and go on to the next presentation, which is Jenna. Um, and Jenna, again, is the Director of Programs at Manna Food Center. And I'm going to switch out presentation here. There we go. All
Great.
right. Thank you.
Thanks,
Welcome,
Kate.
Jenna.
Thank you. It's really nice to be here. I think this idea of this encore, I was going to say performance presentation, is such a good one, and I feel like we're going to use it at any of our conferences that we host going forward. So, as Kate said, my name is Jenna. I work at Manna Food Center, which is a food security organization serving Montgomery County, Maryland, so just outside of DC. We offer direct food assistance, assistance with nutrition benefits, food education, and do advocacy around food system issues in our county and our state. And I'm going to talk about one program in particular, but I'm going to mention two. So I'm just going to give you a quick overview of those two programs. So as we dig into our partnership with Red Wiggler Care Farm, you have a context for what programming I'm talking about. So the first is our Farm to Food Bank program. And so even if people in the audience have not worked at or with food assistance providers before, you can understand, I'm sure, that we need to have inventory to share with our community members. That inventory typically comes through donations or purchasing. Farm to Food Bank is a way that we purchase product from local farmers, and we use some of that product in our own food distribution services. We also contract with our county to be able to provide that local food to about 45 or 50 of our peer organizations. And we'll dig a little bit more into that program in a second. The other is Community Food Rescue, which is not depicted here on the slide. This is a program that Manna has run or did run for about 14 years. And that is donation based. So this is surplus food from any food business in the county. So that could be a wholesaler, a restaurant, caterer. But our first partner was actually a farm. And so that is another way that we've partnered with Red Wiggler over the years, and I'll mention that in a bit. So Farm to Food Bank, Community Food Rescue, now you have a sense of when I mention those, that's what they are. So Manna has worked with local farms for, gosh, now over 25 years. And we do that for multiple reasons. Two main ones that I'll talk about are, one is that we really want to provide the freshest, highest quality product when we're distributing food to people experiencing food insecurity. We don't subscribe to the notion that just because you are experiencing economic hardship that you should have to make do with whatever is around or able to be given to you. We want you to know that you're valued, and so we try to provide really fresh, nutritious product. And then the other is that Manna's vision as an organization is a community where all people at all times have access to safe, sufficient, nutritious food. And we really believe that we're not going to get to that reality unless we are investing in our local food system and our local food producers. So for that reason, way back when, just before I had started at Manna, we began working with local farms and farmers markets. And actually, Red Wiggler Care Farm was the kind of founding member of what became our Farm to Food Bank program. So at the time, the Woody Woodruff, who founded Red Wiggler, was buying up product from many of the peer farms in the area. No other care farms, just farm businesses, and aggregating that product at Red Wiggler, and then Manna was going to pick it up. And we were purchasing the product at a discounted rate. So I was lucky enough to have Woody kind of teach me the ways of the program for the first little bit that I was hired at Manna, and then eventually we took on the program full time. And we were contracting with, at that time, about just 4 farms, Red Wiggler being one of them, and we were buying up product for like $1.20 a pound for any product that you had. So whether it was something that weighed a whole lot, where $1.20 a pound might be an okay price, or whether it was greens like you see in the image here, we were paying you $1.20 a pound. So not many farms could participate at that price point. Farms are businesses and have to be able to focus on their bottom line, and that just wasn't really possible at that price. So enter the pandemic and the stimulus funds that pass through the federal government to the county, and we got sort of a bunch of funds injected into this program. And for the first time, we were able to create a pricing list that was different for each item and took into account what the wholesale price for that item is and what the retail price for that item is. So we try to be above wholesale, but we're slightly below retail. So with that, suddenly more farms could see themselves participating. And of course, we had the situation where it was a time when some farms were losing other customers, like restaurants who had to close due to COVID. So with those two factors in place, we went from 4 farms to 11 farms, and then eventually now we have about 31 participating farms in this program. And we're buying up, as you can see on the slide here, about 160,000 pounds of product and sharing that across the food assistance network in Montgomery County. But I think, Manna would not have been set up to create the program that it is now if that initial partnership with Red Wiggler hadn't really started at all back then. And you can go to the next slide, Kate. So we honored Red Wiggler for their outstanding partnership and their long-standing partnership with us. I think at this event, it was their our 20-year anniversary as partners, and that was, gosh, almost 10 years ago now, if you can believe it. You can go to the next photo. Thank you. So Red Wiggler sort of founded the Farm to Food Bank program and is a participant now. So they'll make offers of product at the price point that's set in the list that I mentioned. And they're also still partnering. Well, we're still partnering with Community Food Rescue before we had to hand that program over to the county this year. So we're no longer in the intermediary there, but I want to recognize that they were also a donor of product. And in this image, you are seeing some gleaning. Red Wiggler has been, so this is another way that farms can partner with food assistance providers like ours, which is to just host gleanings at the site. So if you have product that you're not going to be able to harvest for whatever reason, it's an activity that volunteers love, and it's a great way to get some really great nutritious food out of the field and into or onto somebody's table. You can go to the next slide, Kate.
I was just noticing a Penn State sweatshirt there too,
I
Cher.
know, look at those connections.
Look at
I
this.
picked that especially for you, Cher. This is another actually image of the food recovery. So volunteer picking up some spaghetti squash from the farm. There were so many photos I couldn't had to narrow them down to just a few. I think you can go to the next one then, Kate, or I'll mention where we are now. Okay, so I've talked mostly at this point about where the partnership has been and to some degree still is, but several years ago, Red Wiggler reached out to us to have kind of our annual conversation about what we were going to do together for that year. And this particular year, the staff there announced that they really wanted to find a way to partner more directly with schools that were in their, I think if I remember correctly, it was about a 5 to 6 mile radius of the farm. Really wanted to do more of a hyper-local partnership. And Manna was already partnering with, we partner with about 80 schools in the local public school system through direct food assistance. And so we already had those partnerships to bring to this desire of Red Wigglers to get more closely aligned with the school system. And so we created what we now call the Farm to School CSA. And the way that this works is that we, Manna, pay Red Wiggler a set price for a share kind of style program over 16 weeks at 2 schools that are very close to the farm. And so we're providing shelf-stable product on a weekly basis while Red Wiggler is delivering their fruits and vegetables, mostly vegetables, to the schools. So it's a great complement. So we're able to provide households with both kind of pantry staples, but also the fresh items that they're really looking for. And Red Wiggler takes care of really most of the program, the evaluation, and they're working directly with the schools we're at this point kind of just footing the bill because it really complements the kind of work we're already doing with the schools. You can go to the next slide, Kate. This is just an example of these last few photos are examples of kids from those schools going to the farm. So I mentioned very early on that Manna does food education, and we host nutrition education and cooking classes at the elementary schools that we partner with. And so this was a way that our partnership really took on another layer where the kids who are at the two schools that we're working with are invited to the farm probably a couple of times a year. What I couldn't find a picture of was that we brought our mobile kitchen out to the farm the first time we did this. And so the kids were able to harvest something and then make a dish on the mobile kitchen. The mobile kitchen is now since retired, so these are more recent photos without the kitchen pictured. But you can see that kids are getting to learn how things are just picked right out of the ground. So where do carrots come from, if not the grocery store? So this is a great example of the synergy of the partnership where we really care about educating kids about healthy eating, and so does Red Wiggler. So our shared interest there really made this kind of part of the evolution of the partnership happen. I should also mention that Red Wiggler provides 20% above what we pay for in terms of product. So still finding ways to kind of donate product while we're also recognizing that all this food growing takes staff and time, and I try to avoid asking farmers to donate product for free, when we want to recognize all the work that they do. Is there one more? I think there might be one more photo, Kate.
I think we're to the
Nope.
end of the
Okay, great.
yeah.
Um, so this is where the partnership is now, and just this year, I'll end by saying we collaborated on a grant proposal, so hopefully we can expand this program. It's been kind of stuck at the same level of service for a while that's been, what our budget can support. But hopefully we can get this grant and expand this program to even more students at those two schools. So I'll stop there, and I'm happy to take any questions about how we work with farms in general or how we work with Red Wiggler.
Jen, I think I would ask you sort of the same question that I had for Cher. Really
Sure.
interesting that Red Wiggler was sort of the inception for working with a lot of other farms. If you're just starting a care farm, what would it look like for somebody to approach a hunger relief food access organization? Where would they even start? Is that something that most places will have advertised, or if you don't have a program? Or are you
Yeah.
thinking most places, most food banks and whatnot would have a program now?
Certainly more have programs now than they did prior to COVID. But I will say often, even if a food assistance provider and the leadership of the food assistance provider really has an appreciation for local food, they don't always feel like they have the budget to sustain purchasing local because it in almost every case the local product is going to be more expensive. So I would um, give you the advice to just be prepared for that conversation where it's going to be, well, I buy, carrots now for this product, this amount, and you probably can't get close to that if you're going to be trying to sell the product. So I think it certainly helps that Red Wiggler has this model where they're able to contribute a certain amount over top of what the food assistance provider is paying for. Um, so that could be one way in is maybe try with a donation first, just to show people what the product is, how you can package it. That will be a consideration for food providers. Is often, small farms don't necessarily have the capacity to be bundling greens together or washing everything before it comes to the food provider. So I don't just be prepared for those kinds of questions and that kind of conversation. I would say Gleaning may be another door in. Many food providers that, again, are maybe not purchasing product, but perhaps they've done gleanings or kind of know about that concept. So that would be a way to kind of invite people from the food provider in and onto the farm to start their relationship, if that were an option for you. And lastly, I would say maybe, starting by thinking about providing food for a special project. So if you're going to approach your very large, food bank in your state or your county, realize that they're having to source hundreds of thousands of pounds of food. And so what you're able to provide is going to seem like a very negligible contribution in terms of volume. So thinking about, hey, do you have any like school programs or something that's a little bit more boutique, if you will, and entering into the conversation that way, as opposed to trying to sell products to sell a little bit of product to an organization that's aiming to, offer millions of pounds of food over the course of a year.
Gotcha. Good points. Thank you.
Mhm.
We have any questions in the chat? All right. Well, I'm going to go ahead and move forward, pull up our last presentation. There we go. Well, thank you, Jenna. And now, Amy, welcome. And looking forward to hearing about your partnership with Children's Home.
Thank you so much. I'm Amy Grace. I'm a marriage and family therapist, and I come to care farming through the mental health aspect. And so I started Imagine That Farm back in about 2019 when we moved to Idaho and bought 5 acres and got horses and goats and chickens and ducks and turkeys and all the things, and started bringing my clients out to do therapy. And it was a very sort of holistic kind of approach to therapy, using the entire ecosystem as a way of connecting and addressing issues and creating some healing and growth. And at the time, I was one person doing all the different pieces. I was doing the therapy, I was doing the marketing, I was doing the budgeting and the financing, and I was doing it all. And it was a lot. And I quickly realized that I needed help. And I had a long-term vision that I really wanted to expand the concept of care farming in our community. So my first connection, I want to just show you on the bottom of this particular slide. I have Imagine That One by One Warm Springs and Children's Home. So I am Imagine That. And in 2020, I met Linda Haley, and she and I together formed the Warm Springs Care Farm, which was a second care farm that was in our community. So I'm in Eagle, Idaho. She was in Boise, Idaho. And Linda and I would go to her farm and I would do therapy there, but she was taking on a lot of the other tasks and growing her own farm, and um, really had the bandwidth to do more of the kind of administrative pieces. And so through some networking and relationship building, we were introduced to Children's Home Counseling Services, which is a very big agency in our Boise area that provides mental health services to children and their families. And we invited Children's Home out to our farms, and we introduced them to the space and to the concept and to the type of therapy that we were providing. And they quickly became interested in what that would look like to provide that type of service to their client base. So we did a pilot program for a year. well, I'm going to go to the next slide, but before I do, One by One Foundation was another farm that we added just over a year ago, and I'll come back to that. But Kate, if you want to move to the next slide. So what we did was we did a pilot program with Children's Home. And after that pilot program was successful, we continued by opening up a third farm. And that third farm was One by One Foundation, located in Meridian, Idaho. So we're all located in what's considered the Treasure Valley. And it's a large community. We've got about 700,000 people in the Treasure Valley. About 250 of those are in Boise, in Ada County. But so what we did was we looked at how do we create partnerships so that we can reach more clients, have more support, not feel like we're all trying to do everything, and meet the needs not only of our immediate community, but our sort of extended community. So imagine that in Warm Springs Care Farm partnered with Children's Home Counseling Services. And like I said, once the program proved to be quite successful, we added another farm, One by One Foundation. Um, and imagine that my role has shifted. I'm not really doing the actual therapy anymore. I have provided the clinical model for the Care Farm mental health program. And I do the training of the therapists and I oversee the relationships with the farms and I kind of manage the relationship part. Children's Home, they provide the therapists and they provide the clients. So when they have about 3 therapists right now that have been trained and that are operating at our different locations. The farms themselves, one, Warm Springs is a small kind of urban farm site. It's right in the middle of downtown. It's 2 acres, but we have horses, goats, chickens, ducks, turkeys, bunnies, and, a garden space. One by One Foundation is 10 acres and it's a little more rural. And so they actually have an agricultural component. And in addition, they have a variety of animals, including donkeys and sheep and pigs and goats, etc. So the farms provide the environment, they provide the infrastructure. Children's Home provides the therapists and the clients. And imagine that, which is me, I provide the training, the supervision, and the management. And this way, we all have a role that we play. We have our own responsibilities. And I just kind of make sure that we're all communicating well with each other and that everything is, operating smoothly. And this lends to the shared goals that we all have, which is to expand access to mental health services for children and families, to integrate the concept of care farming into mainstream care, and to also scale the sustainability of a care farm program. So we can go to the next slide. So those are the partnerships that we have, and the function that every partner plays is, like I said, I'm providing the evidence-informed curriculum, training, supervising, and making sure that we are providing quality care that is consistent. The farms have the nature component, the farming component, the gardening component, the animal-based therapeutic setting, and they are managing all of the day-to-day operations for their farm and making sure that we have a safe space in which to work. And then CHS, they provide the therapists, they refer the clients, and they embed the care farming program into their existing systems. So the result is that we have a fully integrated model where experiential therapy is delivered within community mental health, not outside of it. So the next slide is why it's working. It's working because we have shared responsibility and shared leadership. So not any one of us carries the full burden of running the Care Farm program. Each partner operates in their own sort of lane of expertise, and it allows us to build for scale. So the curriculum and the training is replicable. It's something that we offer twice a year, and it's also free because our Care Farm received a very generous grant through Key Bank Foundation last year, and it's a 3-year funding source for us. So because we did the pilot and we had success and we were able to demonstrate growth, we were able to go out and do fundraising and write and apply for grants. So as part of that grant, we provide this additional sort of education, and we call it nature inspired and animal assisted therapy because not everybody wants to work on the farm, but there's so many concepts that we can learn from nature and from animals that are applicable in any kind of therapeutic environment, whether that's outside or inside. And so the training that we have is relevant for all kinds of mental health providers, especially those that are working in the farm settings. And we can continue adding farms without reinventing the wheel all the time. So we actually have another farm that we are launching in June. And this is in another community and gives access to a different, demographic in our region. So the supervision and the structure, it ensures consistency so that we're all doing everything kind of the same way. And it includes traditional mental health standards. So we're following the legal and ethical requirements that any therapist would be operating under. And this community rooted, meaning local partnerships increase access and trust. So we can be a primary care or we can be an adjunct care. And we are just also now starting to partner with occupational therapists as well that can come out to the farm and provide their services. So we're really just trying to address all the gaps in care that exist in our region. And then our last slide is about our impact and the impact that we're making. So we've trained about, I'd say close to 70 therapists over the past 2 years. Children's Home has 4 therapists that are working on all of our different sites and locations. We work with um, currently about 50 clients that are seen on a weekly basis, and that number is growing. Um, System level change, the Care Farm therapy program has integrated into the community mental health system. So we're talking with schools, we're talking with other counseling agencies, we're talking with hospitals, and it's not necessarily a niche service anymore. It's becoming more mainstream and part of the continuum of care. And we are launching actually this month in May, we are launching a membership model so that all of those people that have gone through our training have an opportunity not only for continued sort of education and information and knowledge and support, but also if any of those therapists want to tap into our farms, they can do so through our membership model. And what that means is that they can bring their own private individual clients to the farms for a small fee and have access to that space. And so this just expands the care farming opportunities here in the Boise area. And we are always looking for new farms. So we go out and we talk to farmers. There's a lot of people that have the space that aren't using it the way they traditionally did in the past, and we're sort of repurposing the farms. So the key takeaway for us has been that this partnership model, it transforms care farm therapy from a single site program to a scalable community integrated system of care. And I don't know if you can hear that, but the people just started mowing my lawn and it got really loud.
Can't hear a thing,
You
so we're
can?
good.
Okay, good. So with that said, that's really how we have approached care farm therapy and how we have evolved over the past 3 years now. So,
Thanks, Amy. You kind of already talked about this, but just a question in terms of the replicability. It sounds like you can go to a traditional farm and have sort of a care farming model at that underpurposed or underutilized space, but also the same thing with other social service providers then. Am I hearing that right? Like with a school or maybe the VA or something where you are embedding this type of this care into
yeah,
their
so
models too?
we're trying to make it accessible to more people. We do specialize in children with mental health issues,
Yep.
but we have other providers that might work with veterans, that might work with addiction, that might work with other types of presenting problems. And so if they go through our training, we teach them how to incorporate the farm space, that full holistic ecosystem into their work so that they can address the needs of their clients.
And am I correct then that the folks that are receiving training are currently licensed as mental health practitioners,
They're
correct?
licensed and pre-licensed.
And pre-licensed.
Yeah, because we work with interns as well. So, and I provide a variety of supervision, whether that's clinical supervision or just supervision so that people can receive support while learning how to integrate the farm.
There is a question in the chat.
Yeah, let's take some of those. Now that I'm not screen sharing, um, let's see. The question, Amy, how does the funding flow? So how are the farms funding operations?
So, each of the farms, the first year they donated the space. So, right now we are just in the process of starting to supplement Warm Springs Care Farm. And they asked for a very low fee donation. They asked for $5,000 for the year. And they also do their own fundraising efforts, and they have their own programs outside of therapy. So they have a variety of ways that they generate income for their farms. And after the first year, then we include a stipend. All of the money that we have is through grants and through fundraising efforts. So, like I said, we received a substantial grant. It is covering us for a 3-year period. We're into year 2 right now, and that allows us to do all that we're doing and make sure that we're able to see clients. So, money is the hardest part of all of this because
Mhm.
everybody needs to make money and survive. And It's the most challenging piece, and honestly, without the grants, I'm not really sure how we would make it all work.
Mm-hmm. Sure.
So.
I'm curious with the funding opportunity that you mentioned that is funding you for 3 years. Was that a new grant or were you aware of it? People are always asking about funding opportunities to either pilot or try a new partnership, and it sounds like
Yeah, so it
a good
wasn't a
one.
new grant. It was a grant that is often awarded annually.
Mhm.
And in fact, I believe that Children's Home had received funding from them previously just for their traditional therapeutic services. But when we approached them with the Care Farm program, we used all the statistics from the pilot program, the surveys, and the data that we'd gathered. And it was just very compelling to them. And it was something that they'd never really heard of. And they really liked the idea of not only how are we providing services to the community through Children's Home, but how can we expand our reach and work with other therapists and train them so that they too can have access and offer any kind of outdoor therapy. And so um, they they actually gave us a special grant that we didn't, we applied for their standard 1 year grant, and they ended up giving us a 3 year grant.
Mm.
So, and that's not a piece I was deeply involved in. Again, like this is the great part of where roles and responsibilities come in and people being able to use their own expertise. Because I'm not an expert in grant writing, but Children's Home has a, development director who does that. And so she was able to take the lead on that. And, I filled in the gaps, but yeah.
Yeah.
Amy, what was your original like if someone's like a new farmer and they wanted to partner with an organization like Children's Home, like what connection should they look for or what was your existing connection? Like how did you find that partnership where they were writing the grant to kind of help, fund your idea or this
It is
project?
all relationship building. It is, and I can't emphasize that enough. All of the opportunities that we've had are through nurturing relationships and sharing the vision of what care farming is, what it does, and how it can benefit them just as much as it benefits us, just as much as it benefits the community. And it's giving them the experience of it. So we spent a year like courting Children's Home and having them out and doing demonstrations and doing initial trainings and letting them have the farm space so that they could have their annual team building events. I mean, we did a lot of um, giving of our own time and energy and resources to build that relationship. And because they had such personal positive experiences while they were at the farm, they realized that just being there is therapeutic. Just and then to add on top of that, the programming that is more intentional and evidence-based, it was something that they just really resonated with. So,
I just want to note, I have put a couple links in the chat. Amy, when this project, when I first heard about it, I wanted to know, like, how did you get that funding and how did that all happen? So you put together a couple really nice resources for us. CFN does have an online resource library, which is free to access. And so those links are directly, well, they link to your work with Children's Home and your timeline and go in a little bit more in depth than
Yeah.
the grant. So,
And I'm always available for conversations and questions.
and there is somebody who is asking about, would it be possible to share the farm information to her? If you can see the chat in there.
Let's see.
That's willa@sus.org.
Share the farm information. Okay, I will do that. I just learned that I let my Imagine That Farm website lapse. Forgot.
Uh-oh.
So I need to get that back up and running, but I will share Warm Springs Care Farm and I'll share One by One Foundation as well. So
We have just a few minutes left. Any other questions that we haven't either gotten to in the chat? I guess there was one question about a possibility for insurance to cover the cost in the future. And I think maybe this just goes to one of my questions for you all. Partnerships are oftentimes dependent on funding. Jenna, I know that you were saying that, we've had maybe some changes. Well, I'm editorializing here, but there's been some changes to the how hunger relief organizations are receiving some money. Cher, I'm sure that you see that in extension. How do you weather the storm in partnerships when funding can become a challenge? And is there a benefit to the partnership itself above and beyond funding, maybe I should ask? Anyone want to take that? Or I can just leave that. It's maybe a very open-ended question and some, again, editorializing here, but
yeah, I mean, it'll be interesting to see what happens when this particular grant runs out next year in 2027 and what that commitment will be to renew. So I think that there's a lot of unknowns and I know for us, we do a lot of just day to day, month to month, year to year kind of planning.
mm,
So
I have one quick question. Thank you so much. This has been so informative. I have been working in the disability space and now have moved over to just consulting on the whole and also inclusion. I did a lot of affordable inclusive housing. But I'm wondering in that same line of thinking about potentially having, which I realize it's a complete long shot for the insurance, but I was wondering that hospitals and treatment centers that are super expensive, I wonder if, and they always have wait lists and overflows, if that would be like some kind of partnership or alignment where you could kind of take the run over for those people that are waiting, because a lot of your experiences could be like a day treatment experience, and maybe that would help alleviate the overwhelming wait lists as well as the burden for parents because the cost is always out of pocket. And maybe there's something to be said about partnering with those treatment centers and or hospitals. Just a
yeah, we do. We are in the process of, building those relationships with hospitals, but I'll say that we already have a wait list for our Care Farm program, and we've got 3 farms now. So we actually need therapists. We actually need more therapists that want to do that kind of work. So,
yeah, I think one of the things that we hear very often at Care Farming Network is there is a lot of demand for services on care farms. And so a little bit of if you build it, they will come. Sharon, to your question, I'll say this is just one example, but there is an organization in Massachusetts called Gamma, and they run both a residential and day treatment substance use disorder space. They actually accept Medicaid and they operate off of a farm. So there are ways that you can do this. I know they also have, I think at the conference we heard it was at least a 9-month wait list there for their day program for youth. But there's ways around that. I think probably state dependent on whether or not you can access those funds and what you provide, but definitely certain models out there that are accepting insurance on farm.
And I'll just add that we do accept insurance for our therapy services. So, we bill and we get paid. Children's Home gets paid through insurance, but it's just not enough to pay all the different players. So, and especially because we do some equine therapy as well. So we have, sometimes you're working with a horse professional in addition to a mental health professional. So,
Well, we are at the top of the hour. Thank you for providing your expertise and your willingness to share so openly about the wonderful work you all do, specifically around being part of a community and being great partners. Just a few quick things for anyone. Please, you can find out more about Care Farming Network at carefarmingnetwork.org, including additional or future events. And we will be following up with some shared links from our conversation today, as well as the recording for you. So hope to see you all back at a future event. And big thanks to Cher and to Jenna and to Amy for joining us today.
thank you.
You.
Thank you, everyone.